Hi, this is Dr. Blad with Leaf Chiropractic here in Mound, Texas, and I want to do a video about lower cross syndrome. And this is when you have an anterior hip for a long period of time, you start getting back pain, and you can even get upper back pain and neck pain from this. But this is part of the whole upper cross syndrome and lower cross syndrome. So it's really important that we correct this, because if not, it could lead to degeneration, nerve impingement, bone spurs, and herniated discs, and of course, low back pain. Now, people get this lower cross syndrome from sitting a lot. If you have a job that requires you to sit a lot, or if you're sedentary, this is something that you need to really work on. So today I'm going to teach you some exercises to both stretch and strengthen to help correct the lower cross syndrome. Now, the most important thing is to get this properly diagnosed. And here in my clinic, I use a digital posture analysis that shows us which muscles are weak and which muscles need to be strengthened and which exercises need to be done. Now, the exercises I'm going to show you today are my top 5 stretches and exercises. So this is a good place to start, but after you master these exercises, then you need to go on to the next level. And that's where I send out a prescription at each phase, usually about every 2 to 3 weeks. They need to be upgraded to the next level. But we're going to start here with these low back stretches. Now, one of my favorite stretch is the standing quad stretch. So Lexi here, Lexi's gonna show us how she's gonna demonstrate how to do these stretches and exercises. So the quad stretch is like, now the important thing is when you're trying to stretch these quads, and arching your back and bringing your neck back is also important. That'll put some extra stretch back here. Now, when you're trying to correct lower cross syndrome, you always stretch the quads. You don't want to strengthen them. You want to strengthen the stomach, and then you want to strengthen the glutes. Those are the 3 things that you need to focus on with lower cross syndrome. Okay, so that addresses our quads, so we stretch those out. The next one is our hip bridges. Okay, so let's stretch out. This is a simple. A hip bridge is a nice simple exercise. Now, you start up high, and then you go and you stop like down a little bit, and then you go down a little bit more, and then all the way down. So you want to go 1, 2, and 3, and then all the way drop, and then you want to do 10 to 15 of those. That's a hip bridge, and that really helps get the glute. Now, what's really important, and what Lexi's doing right now, is as you're going up and dropping down, you've really got to engage those glutes. That's super important. You've got to really clench the glutes, because glutes are what become asleep when you sit a lot. They need to be activated. So this is a real good one to really start to activate those glutes. But if you don't focus and think about clenching those glutes, then you're not getting the full benefit of this stretch. Okay. All right, Lexi, thanks. So the next one. So those are the stretches. Now, another exercise to strengthen the glutes are step-ups. So we're going to use a step-up box. And again, as we do these step-ups, the same principle applies. As Lexi goes up, as she makes that up step, she's going to clench the glute and really focus to get that glute engaged. She's going to do one side, and then she'll do the other side. And that's a simple step up. Now they look simple, but again, the idea is to really clench your glutes as you do it. Okay? So those are the 2 to strengthen your glutes. Now let's talk about strengthening your abs. So there's 2 that I like, and they're simple. It's a simple crunch. Now the idea with the crunch as you go up to is you want to keep your head kind of back. You don't want to strain your neck going too far forward. So as you come up, try to focus on keeping your head in a backwards position. Okay, and then you're going to do 15 or 20 of those, and then once you get some abdominal strength going, the next one are V-ups. And I like V-ups because V-ups will address both your upper abs and your lower abs. So that's how you do the V-ups. And again, she's doing the 1, 2, 3 on the way down. Okay. Good. Great. Okay. So the next strengthening exercises we're going to do for lower cross syndrome are hip thrusts. Now, these hip thrusts, you get a table or on your bed or anything where you can get in that position. And again, clench your glutes as you push up and as you go down. And these are the ways you can begin the hip thrust. But then once you conquer those and you're comfortable with those, you can use weight. And you can use books or anything that will put some kind of resistance on your belly. So as you thrust up the hips, you'll even strengthen it more. Okay, thanks, Lexi.
Sure.
Okay, so that concludes the lower cross syndrome stretches and exercises. Again, it's super important that you get a posture analysis done to know exactly which ones. And again, this is the beginning process. There's other exercises that with my patients I send out prescription exercises every 2 to 3 weeks so that we add to the strengthening portion of this. It does take, to correct posture, it does take a good 2 to 3 weeks for posture correction, but it's very important that there's 3 things to correcting your posture that you need to do. One is the chiropractic adjustments, help unlock the joints. Number 2, you've got to use what are called corrective posture devices, or I call them orthotics. And in my clinic, I use a neck orthotic for the head, and for the low back, use a low back. This is like a half roll, and you lay down on that. So those are the 2 devices that I use to correct posture. And the third thing to correct posture are exercises. So if you do those 3 steps, then you can correct posture, and you can do a pre-posture analysis and a post-posture analysis and do a comparative. And it's really neat to see the improvement in your posture as you go through these steps. Well, I hope that helps. And if there's anything I can do, please reach out. If you have any questions, I'd be happy to answer. Thanks.